Care and Development Organization CDO is a non-government, non-profit organization based in Nepal dedicated to relieving the distress of people living in extreme poverty. CDO works to improve the lives of underprivileged people working in carpet factories and brick kilns, internally displaced people and women in need. CDO provides support for whole families and special attention is given to the welfare of women and children. During the years of Nepalese Civil War, from 1996 until 2006, more than 15,000 people were killed and many people left the remote villages which were devastated by the conflict. They sought shelter in the cities and thus an estimated 100,000 to 150,000 people, mostly women and children, were stranded in Kathmandu. The majority of displaced people stayed in Kathmandu Valley even after the end of the war, and many of them eventually found work as seasonal laborers in one of the numerous brick kilns. Brick factory work, however, is low wage and very physically taxing. Furthermore, their constant exposure to the dust of bricks makes this work very unhealthy. In order to support this displaced person, CDO was founded in the year 2005. Two people, Pradeep Singh and Arti Basnet, have been central to founding and running of CDO Nepal with inspiration and support provided by the 9 board members of the organization and Father Joe, our chief patron. 5 outreach programs have been started addressing the needs of different groups of people. Brick factory outreach, school outreach, remote village outreach, local community outreach, care family home. Brick factories are notorious places of work that attract poorest of the poor internal migrant families. These seasonal laborers work for hours under a scorching sun in tough working and living conditions of the brick factories. Children often work alongside their parents to meet the family's needs. We reach out to these folks through our brick factory outreach program. We conduct mobile health clinic and awareness program in the brick factories itself, as they rarely get to venture outside. A special children development program has been initiated that helps the children of brick factory workers to engage in educational and recreational activities. CDO Nepal provides nutritious meals to students of local public schools and conducts health camps for them under the care of professional pediatricians. Our licensed staff nurses and volunteers also carry out school health education programs and teach young students about the importance of hygienic habits. People of remote villages around Kathmandu Valley are often overlooked by 8 organizations. They fall in the blind spots. These are the very locations where CDO Nepal works most actively. We conduct safe motherhood and child care program to help the most vulnerable pregnant women and very young infants along with their mothers. We provide medical checkup facilities and distribute free medicine and nutritional packets to stay healthy. We also conduct mobile health camps, health education and health training in these villages that see a turnout of thousands of people from scores of surrounding villages. One of the major problems in the communities is the lack of awareness in matters of health, sanitation, environment, and education. These conditions have posed a big threat to the health of the people and the community in general. CDO's community health program is one way to reach out to the communities to create awareness concerning proper health care, to address the challenges that people face, and to discuss the solutions they can develop. Another focus of CDO's activity in local communities concerns income-generating programs for single women, most of whom have lost their husbands during the Civil War. In 2005, our care family home took in 10 displaced children between 6 and 9 years old. These children came from conflict-stricken remote areas and were in desperate need of safe and loving environment that would allow them to enjoy their childhood. Currently, CDO Nepal's programs benefit 70,000 plus people, including women and children, who now have access to basic healthcare and education facilities. In the years since its establishment, CDO Nepal has grown into a well-recognized care and relief organization in Kathmandu Valley.